Hi, my name is Ruth and I would like to welcome you all here today. So this is our first of two sessions on asthma and asthma in children. And the first one this evening, we're going to look at asthma in general, and then the next session then is on asthma management. So we will look at medications and how you're going to manage your asthma, your child's asthma. So I do work with the Asthma Society. I'm a respiratory nurse specialist with the Asthma Society, currently running the WhatsApp service, which I'll talk a little bit about towards the end. So before we start, I'm just going to share the screen here and hopefully it will work. So as I said, we're going to talk today, first of all, just about asthma in general and kind of what causes it, what's going on in the airways as a result of asthma. So, and it is going to be on asthma in children, so we're going to focus on children today. So what asthma is, it is a common condition that causes redness and swelling of the airways. The airways are small tubes that carry air in and out of the lungs. So basically asthma affects all airways. So it's right from your nose right down to the bottom of your lungs. So it's not just a chest problem, it is actually a nose problem as well. And we'll talk a little bit about that more later on. Asthma does cause narrowing of the airways, causing them to become oversensitive and react to things that you normally wouldn't cause a problem, such as like cold air and dust and pollens, and there's loads of different things, and which are called triggers. And we will discuss these in more detail later on. So basically your airways, as that on the last slide there you saw there the picture of the airways, and we'll show more pictures of these later on, kind of what's actually going on in these smaller airways. So that's the kind of the whole lung in your two lungs, and your airway tube that comes from your nose right down to your lungs. And as you can see, it splits up there into two different bronchi or bronchus tubes. So if you were to turn them upside down, it actually looks like a tree. So you can see the little branches there, and like your trachea, which is your main tube here, is like the tree trunk, and then you have all your little branches. That's just an easy way to explain to children as well what your lungs actually look like. So in terms of what number of children have asthma in Ireland, so 1 in 10 children approximately have asthma in Ireland that currently actually have it. And basically, I suppose about 1 in 5 children do experience some asthma at some stage of their life. So that will indicate that you can go out of your asthma. So what they estimate is that about half of children under the age of 5 will actually wheeze at some stage in their lifetime. And of that half of them actually will develop asthma, and the other half doesn't. So of children that do develop asthma, about 80% of them will actually go on and maybe grow out of their asthma. And of that 80% that do grow out of their asthma, it can recur in later life. So just to bear that in mind, and it can occur at any stage, reoccur again at any stage in later life. It could be as a teenager, or it could be as a younger adult, or indeed even as an older adult. You actually can diagnose asthma in people up in their 70s. It's not just a young person's problem. So it's just to bear that in mind. So as I say, it is a very common condition, and really 380,000 people have asthma in Ireland at the moment. And of that, then you have about 890,000 people will have had asthma at some stage in their lifetime. So on average, children miss about 5 days of school every year, which is a lot. And really, if their asthma is well controlled, there shouldn't be any need for that, but it does happen, unfortunately. So the whole aim of the game is to have asthma as controlled as possible. So what actually causes asthma? Well, I suppose to a certain extent we don't really know, but we kind of do know that genetics do definitely have a role to play. So if you have a mother, father, brother or sister that has asthma or any sort of allergy, so whether it's hay fever or skin eczema, that actually can trigger the body to react in this way and cause asthma. So the genetic thing is very important. Usually in childhood, if as I say, yes, a lot of children do develop it, but you can develop it at any stage of your life, but it is quite common that it is developed in childhood. Again, if there's an allergy link, as I said earlier, if it can be due to allergies like with pollen, and you might just have hay fever, but there is a link because about 85% of people that have asthma do have hay fever as well, so it is important that we manage that correctly also. Modern lifestyles, unfortunately, does have a role to play. So we're all living in nice airtight houses where air doesn't circulate that much with the windows and doors, etc. And our houses are nice and warm, maybe too warm, which isn't great either. There is an increased risk then of developing asthma if you are a smoker during pregnancy. So if you smoke and you're pregnant, there is a risk that that child, when born, may develop asthma. Obesity and being overweight definitely is another link, and we've seen that a lot now. Obesity is now termed as one of the triggers for asthma, and we see, you know, asthma developing in a lot of people that are actually obese and overweight. Viral respiratory infections can trigger asthma as well, but you can actually just get viral respiratory infections on their own, and maybe they actually give the same symptoms as if they're asthma, such as wheeze is very common with respiratory infections. So just because you're getting viral respiratory infections does not necessarily mean you're going to develop asthma. Well, there is a link there though, if you are getting a lot of them. There's a possible loss of symptoms, but it never goes away, I suppose, in terms of that's in relation to the infections, where you are actually going to get symptoms there, all right, such as I say with the wheeze, but then it doesn't actually, whenever your infection resolves or whenever it's finished, when you're well again, that means that wheeze might never actually go away, and it actually can maybe trouble you then when you go out for a walk or you go for, the child goes for a run, that actually can trigger it. And I suppose the important thing is we know that asthma is not infectious. That's really important. So the asthma symptoms then, we're looking at cough that won't go away. It usually occurs at night, and particularly at night, it's very important, and particularly in young children as well. It can actually be a very early morning cough, so it's not always just a nighttime cough, but you know, the kids actually get up, awake early in the morning at 5 or 6 a.m. That actually can be a sign, if they're coughing a lot at that stage, that actually can be a sign that it could be asthma. The other sign then, the cough as well, is during exercise, or maybe whenever the exercise is actually finished, maybe whenever 15 minutes after running around, and that they actually can have symptoms. Chest tightness is another common symptom, and it's not one that kind of people are very much aware of, but it is a common symptom. And again, trying to explain to a child, you know, what is chest tightness can be difficult. So that often can manifest itself as a tummy ache in younger children. So a child is complaining of a pain in the tummy, it could be due to their chest tightness. Wheezing then is a whistling sound. So whenever you're actually breathing out, you hear this whistle of the breath. Okay, so it's always on the outward breath that you're going to hear it. If you're hearing it on the inward breath, that's not an asthma wheeze. So again, just have a listen and see when somebody is actually breathing, are they actually wheezing as well? And then shortens the breath then, or what the medical terminology is dyspnea or breathlessness, or shortens the breath is the term. So again, to have asthma, you have to have at least 2 of those 4 symptoms. Having one of them would say that it's not asthma. So to have a diagnosis of asthma, you have to have at least 2 of them. And of course, lots of people have all 4 of them as well. So this is what a normal airway looks like. So if you were to take out one of the airways, those airways that I showed you on the first slide, you know, if you were to take out one of those, this is what it looks like. So you have the muscle coat here is actually nice and calm, and it's nice and relaxed, and the airway is nice and open. So the inner lining of the airway is not swollen or anything. So again, you have all these things here, these mucus glands. They're there, and they secrete mucus or phlegm, basically, or you know, a mucousy type thing. So again, whenever things are normal, this is what everything is lovely and open, and air gets in and out there, no problem at all. So what happens then in the airway? So you can see here on the left-hand side over here, the normal airway, you see there's no muscle tightening and there's no swelling, or the airway lining is all nice and normal. So you actually then develop asthma, or you come in contact with a trigger factor, let it be dust, or it could be a strong smell, or it could be absolutely anything. This is what happens then. So you get tightening of these muscles on the outside. The airway lining over here, which is nice and normal, actually becomes swollen and red, and you get this mucus there as well. Now, just remember as well that with asthma as well, you don't always have phlegm there, but some people will actually cough up a plug of mucus, and that's quite normal. But normally the cough is a dry cough, but mucus can form, and you may get occasional coughing with some phlegm production. So you can see the difference there in the airway. So that little airway there, which is actually quite small now compared to this one. So the air is getting it tight. You can get the air in all right, but when you try to breathe out, this air is trying to squeeze through that little hole there, and therefore that's where you get your wheeze. So again, your cough comes from this lining of the airway. Is actually lined with little hairs, just like the inside of your nose. You have all these little hairs. So again, when you inhale or trigger, so it could be you inhale a bit of dust or you inhale a strong smell, what happens is those little hairs on the inside of the lining of the lung gets all irritated and angry, and that's when you start coughing. So that it's that persistent dry cough as well that's important. It's not a loose phlegmy cough. So you have all that going on in the airways there. So it's you know, there is quite a difference between the normal airway and the asthma airway. So again, this slide just shows us, can you see how the muscle bands are getting tight again around this airway, and again we have got to the phlegm and the swelling of the airway there as well. So the different triggers for asthma then. So basically there's loads of different triggers, and this is just a selection of the most common ones, let's just say. So you have smoking. So again, if you're a parent and you smoke, smoking in front of your child or near your child is not going to help things at all. It's actually going to make things worse. And even if you go outside to smoke and you come back in, that smoke is actually on your clothes and on your breath for up to 4 hours after you smoke. So you know, it's probably the best thing to do is to quit smoking if at all possible. And what we call passive smoking in children, we obviously want to avoid that at all costs. Then we have animals. So this can be any animal. So the usual culprits are dogs and cats, and the hairs and the dander on these animals. In cats, it's actually the saliva that's the big trigger. And again, the other one to watch out for with the animals is horses. Horse hair is actually quite a strong, potent trigger. And even children that go horse riding, you know, they actually can get quite wheezy if they have asthma. So again, that doesn't mean if you have asthma that you're going to actually react to them. So again, it is a matter of trial and error with these. So I mean, you can certainly take your child to horse riding, but be aware that it can be a trigger, not for every child. Running around and exercise. So again, with smaller children in particular, just remember one way of knowing, you know, they're not going to be doing football training or athletics training or anything like that, or going to sports. But if they can't keep up with their brothers and sisters when they're outside running around the garden, that's a sign that something's not right. So again, remember that with asthma and exercise, it's usually not maybe during the exercise, it's when they actually come back in and they sit down for a few minutes, and then the wheezing and coughing will start then. Colds and flus are a very common trigger as well, particularly this time of the year in the winter time. You know, when there are viruses around. So again, protection against that, and we can talk about that next week whenever we're talking about the management about getting vaccines and that. Different medicines also can trigger asthma. So the most common ones that will be used in children that could actually trigger asthma is the likes of ibuprofen or any of the non-steroidal anti-inflammatory medicines. Can actually trigger asthma and should not be given to children that have asthma in case they actually might react to it. So just plain ordinary paracetamol or Panadol is sufficient to give them and is quite safe. Again, feelings are like, so, you know, if you get distressed or under stress or under pressure, or if you laugh a lot, that actually can trigger asthma. And certainly if you get upset and you're crying a lot, that actually can trigger asthma as well. So again, something else to watch out for. The old dust and how to manage dust, that is very tricky. The jury is kind of out as to how effective dust management at home is in terms of managing asthma. So all I would say to people is try and keep the dust as minimal as possible. You will never get rid of it. It is impossible to get rid of it. But things like hoovering the mattress and beds every week, and you do have to turn it over. They actually reckon that about 10 million house dust mites in a double bed, so you know you do have to hoover them. Again, putting a dust cover on your mattress and on your pillows and on the duvets is definitely beneficial, and not to be using feathers in either duvets or pillows, because that will actually trigger asthma also. Then we have the pollens and grass, and that pollen season starts from March once the tree pollens start, because the trees start budding in March. So again, there's different pollens around in March, beech and birch. And then you have later on into the summer, then you're going to have the grass pollens and all the lawns and the fields are being mowed, and then you will have the the flower pollens later on as well. You also then have moles then in September, October time. That can be problematic also. Cleaning products, so it's the strong smells of cleaning products, or any strong smell really. So as I say, anything that is kind of very strong, like anything that contains disinfectant with the likes of any of the ammonia-based disinfectants can be quite strong. So again, to try and use things like bread soda and vinegar and salt, or not salt, but yes, lemon and vinegar and bread soda, the three things that are actually very beneficial for cleaning. So you can mix all those into a paste and use them for cleaning rather than using actual cleaning products. Then you have sprays, so things like deodorant sprays, any sort of a spray, you know, furniture spray, that can actually trigger asthma also. Mildew and molds, as I said earlier, particularly in September, October time and into the winter, where you might have a bit of dampness and that in houses, that actually can be a trigger also. Food and drinks are actually very hard to define, particularly in children, whether they actually have a problem or are going to cause a problem for people with asthma. So again, what you can do is eliminate them for 3 weeks. If you think something is causing a problem, eliminate it for 3 weeks and then reintroduce it and see does that make a difference. There are some different blood tests that you can get done as well. For any of these triggers, actually, you can actually get a blood test done. Now, sometimes they don't give you the answer you want to hear, or they mightn't give you an answer at all. But if they do, then you know for definite, well, then you can avoid that particular trigger if at all possible. The weather then, so cold air, particularly this time of the year, cold air is a huge big trigger. So the way you can get around that is actually putting a warm scarf or just a light scarf or a snoot over your mouth and nose, warming the air going into the airways, and that will actually hopefully not tighten them up as much. There is a link with sometimes with thunderstorms and asthma as well, so just to be aware of that. And then different jobs then, which obviously isn't affecting children, but it may do in their future life. So there are certain jobs that will actually can trigger asthma, particularly where they might be inhaling things like flour and different medicinal shrubs and such, and that might actually make asthma worse. So that's only, as I say, a touch of the iceberg in terms of what triggers might be. For some people, most people actually will have a good few of those, like the dust one, the exercise one, the colds and flus, and pollen from the grass and trees. They're all kind of common enough triggers. So it does sometimes take a time with children to actually find out which of those is their actual trigger. So sometimes it can be a watch and wait situation. Again, asthma is very difficult to diagnose in children. You cannot diagnose it in children under 2. It is difficult to diagnose in children under 6. But if they do present with the symptoms, we kind of do treat it as if asthma, but we will kind of hold off, maybe not diagnosing it for definite until they are over 6. They just be monitored and watched, but we still will treat them with the different treatments as if they do have asthma, because we have to treat that inflammation in the airways, that redness in the airways that I was speaking about earlier. It's really, really important to treat it. So there's no single test that's used to diagnose asthma. So again, particularly in children as well, the peak flow test down here, this is looks at lung function. Again, you have to be over the age of 5 to be able to do that test. So it's very difficult to actually, there's no real test for children under 5, to be honest. And then with children over 5, we can do peak flows. But family history is so important. Looking at the pattern of symptoms, are they during the day? Are they during the night? Is it when they're out running around? That sort of thing. Is it during the winter time more than the summer? Is it more in the summer than, that again, is it summertime more problematic for them? Against, is the pollen going to be a trigger as well? So again, it does take a bit of time. So it might even take a year or 2 even to get a formal diagnosis of asthma. So again, it's, once they're on the treatment for it, that's not a problem. We can listen to their chest, but if the child is healthy and well and they're coming into us and they are very well and they're not actually symptomatic, they have no symptoms, when you listen into their chest, it'll actually be quite normal. And we never ever do x-rays on children either to diagnose asthma, because again, it'll come back normal. So the only time we would do an x-ray is whenever you put them on treatment and they don't actually respond to it. We definitely would send them for chest x-ray then to see what's going on. And as I said, peak flow and lung function testing can be done in children over the age of 5. And then we always usually give a trial of asthma treatment anyway, and then monitor that for 6 weeks and then stop it and then see what happens. Does the child redevelop symptoms, or do they stop for 3 or 4 months and then they go back on it again? And that can be often the pattern, that they might need it for over the winter months and then they could be fine over the summer months. Again, asthma can't be cured, but it can be controlled. And obviously most people with asthma should be able to live a healthy life and be active and involved in everything that every other child is involved with, including swimming. And we encourage as much sport and exercise as possible, and they should have an active life with minimal symptoms. So that's going to be the goal of treatment, is actually to be on as little treatment as possible to have a full and healthy life. So if you're worried about your asthma, these are our 2 helplines that you can actually contact me on. And one is the Asthma Advice Line, which there are a number of nurses that run this, and you can contact the Asthma Society advice line on 1800 44 54 64. And then the Beating Breathless is WhatsApp messaging service. So this means what you can do with that number there is just send me a message on this number, and I get back to you if you have any queries about your child's asthma. Other services that are available as well for you, where you get more information, is actually on asthma.ie. On that, there's a lovely booklet called Asthma in Children, which you can download it. Unfortunately, we're not in the office at the moment, so we're not able to send it out to you. But again, you can actually download that there and you can have a look at that at home. And there's loads of information on our website. There's also a kids corner on the website where children can learn about their airways, like what we did earlier there, showing the different airways and what's actually going on in the airways. And then the next session, we'll be talking about managing your child's asthma. So at that session, then we will go through the different inhalers. And we'll also talk about asthma action plans and how you can use those for your child. So I'm going to leave those numbers there for a little bit longer, and thank you for listening, and I will see you for the next session.